I found out several weeks ago that I'm pregnant again, which is kind of crazy and stressful enough as it is, but I'm 9 weeks now and I haven't been to a doctor because I don't have the insurance to go to an OB.
Tiffany Givens is one of millions of low-income Americans who have been kicked off of Medicaid since April. Most of them have lost access to health care through no fault of their own, but because of something called Medicaid unwinding.
Millions of Americans at risk of losing their Medicaid health coverage after pandemic rules protecting them expired over the weekend.
The Georgia Budget and Policy Institute says the state is not prepared to handle the unwinding of Medicaid.
10 million low-income families nationwide have been blindsided by the loss of their health care, and for a vast majority of them, it was without warning or justification.
I was honestly really surprised, but I thought maybe I had screwed up somehow. Maybe I had missed the renewal letter, or maybe I had missed the email. I never got anything in the mail saying anything about why I was considered a non-qualifying adult or why it should be inactive.
The historic purge of the social safety net has been led by a handful of Republican governors who are hell-bent on throwing people off of health insurance wherever and whenever possible, sabotaging the health and safety of children, pregnant women, and people with long-term disabilities all across the country.
Millions of Americans rely on Medicaid because the jobs they work for 40 or more hours simply refuse to provide access.
You know, I clean houses for people, so I kind of work for myself. Like I don't work for a company or anything that provides insurance.
In order to understand how we got here, we have to go back to early 2020. With a mysterious pandemic raging, the federal government stepped in and expanded the social safety net.
Right at the beginning of COVID, Congress passed a series of bills to help try to shore up health insurance coverage during an economic downturn and a big, an unprecedented pandemic. One thing Congress did was ensure that nobody would lose their Medicaid coverage.
The clause was part of one of the early stimulus bills. Here's how it worked. The federal government sent states more money for healthcare, and states had to hold off on asking people on Medicaid to regularly reprove their eligibility. The deal was to last the length of the public health emergency. During that time, an additional 20 million people wound up turning to Medicaid for access to care. At its peak this winter, 90 million working class and disabled Americans were enrolled.
It was nice to be able to afford to go to the doctor and to be able to afford to take the medicines that I'm on.
Then came the budget showdown between the White House and House Republicans, who were itching to make cuts.
Congress passed a bill at the end of 2022 that established a date when unwinding could start. So April 1st, 2023, that would be the end of the protected period, and that's when states would have to start changing their systems and reestablishing kind of like normal operations, including renewing and checking eligibility for folks.
The federal government gave states 12 months to conduct the unwinding. Every state runs Medicaid differently, but the government stipulated that they would make the maximum effort to keep people enrolled. Not every state decided to comply, and Republican governors have led the way in throwing the poorest Americans under the bus. Arkansas, for example, rushed through the process in 6 months, kicking off 427,000 people, nearly half of those enrolled. 2/3 were improperly removed, even if Governor Sarah Huckabee Sanders defended her state in a Wall Street Journal guest editorial.
The challenge is that there are several states that simply do not want to provide coverage to those who not only need it, but those who are entitled to it.
A lot of people losing coverage never had their eligibility checked at all. Most of the folks in Texas who are losing coverage, our state agency has no idea if they're eligible or not.
I had not missed a review. I hadn't failed to turn in any paperwork or do a review for myself. I don't understand it. And I don't understand how they can do it without giving anyone any notice.
The numbers are brutal. Nationwide, there have been nearly 10 million people to lose their access to Medicaid. 3/4 of them have lost it not because they weren't eligible, but due to something called procedural denials.
Check out this report from the Florida Department of Children and Families. It states 4 out of 5 who just lost coverage were terminated for procedural reasons.
So procedural denials is like a very jargony term that masks a whole lot of barriers in the system that people and parents have to fight through just to keep their kids, their eligible kids, on coverage. The paperwork never made it to their house at all because the state used the wrong address. The call center had a hold time that's longer than your lunch break at work. And our call center in Texas isn't open on evenings and isn't open on weekends. So if you can't call during your job hours, you can't get through.
I was asked, like by my general care provider and by the people in the emergency room, like, have you seen a doctor? Have you been to a doctor yet? Have you been to the OB yet? Like, no, I haven't. And it makes me feel irresponsible when I say that, but it's like, well, no. And then you have to kind of like briefly explain why, and that's no fun either. Yeah, it's really crazy. It kind of just makes you feel hopeless. Like, well, I feel like I've done everything I can do.
Whistleblowers within the Texas Medicaid agency have highlighted that pregnant women who should still be eligible are being removed in some cases. Newborns within their first year of birth, when they're supposed to be covered for the full 12 months, are being removed. So there's a whole series of kind of like system glitches and system errors. Then there are other kids who are very medically complex, kids who might need in-home nursing care to eat or to breathe, and they get that in-home assistance paid for through Medicaid. And when they lose Medicaid, they lose that in-home health care that keeps them alive. In some cases, it's life and death.
The past 24 hours have been a nightmare for Liz Adams. In that time, she found out her 2 kids were dropped from Medicaid. The news also came a day before her 7-year-old son, Brian, was set to have a biopsy procedure. He's currently in remission for leukemia.
I'm mad. I am mad. I do not understand how they can do this to a child.
One national glitch caused around 500,000 children to lose Medicaid before the federal government stepped in and insisted they be re-enrolled. In other cases, some states refused to use opportunities to check people's new addresses with the USPS. For millions of others who were wrongfully disenrolled, they're supposed to have 90 days to reapply. But getting back on Medicaid has been nearly impossible. And that's precisely what those GOP governors were banking on.
I reapplied and I got a letter in the mail informing me of an interview date, but I got the letter after the interview date. Like, it came in the mail like a couple days after the interview was scheduled, so I missed it. I called the office to reschedule it, and the woman at the local office said that she was going to reach out to the caseworker for it to be rescheduled and to keep an eye out for her phone call, and that phone call never came.
One of the challenges that we're seeing in states that are facing the heaviest load is that, unfortunately, they have removed access to staff. It's hard to reach someone. It's hard to get someone to answer the phone. We know there are stories across the region of people who are sitting on the phones for hours at a time.
So then I had to reapply. I went directly to the local office and filled out the paper application, and I went ahead and submitted, like anything I thought they could ask for, like proof of rent, like rent receipts, like my lease agreement, my ID, all of that, anything I could submit that I thought they would want. I turned in, like verification of pregnancy from the health department that I paid for, with my application, and that still hasn't helped speed anything up.
This is a joint federal and state program. The state is responsible for administration, the state is responsible for communication, and therefore the states are responsible for the failure that's forcing millions of Americans out of access and denying them the coverage they deserve.
In August, the federal government paused some states' purges for a time, forcing them to correct some erroneous redeterminations. The government also guaranteed 1 year on Medicaid for children, preventing quick disenrollments. Advocates have called on the feds to pause the unwinding in places like Texas once again, as well as take more aggressive action against states who have indiscriminately purged people. Most critically, they have to actually try to keep working people from losing their care.
The state has more resources, the state has more responsibility to try to find those who need it. That means running more television ads, running more radio ads, running ads on digital. It's doing the work to reach out, but it's also partnering with those community groups that have access to the very people we need to be talking to. And that means talking to churches and other religious organizations, going into schools, making sure kids who are going to be in our classrooms, that they have the information to take home so their parents know they're still entitled to coverage.
We have backlogs, tens of thousands of applications that have never been touched for 6 months now, piling up. So fix all those problems and then restart the process when you're ready, when your systems are ready, when your staff's ready, when you have the resources you need. So what we're calling for is a pause on procedural denials and fix the problem.
People who have been unfairly disenrolled from Medicaid should still reapply because their application will still be valid, even if it takes a while. And there are several other ways for states to reduce the errors and make sure people keep their care.
A good example is One thing that makes the workload a lot easier when you're renewing Medicaid is when the Medicaid agency can use data matching to figure out if you're still eligible. So in Texas, our Medicaid agency gets our Texas Workforce Commission quarterly wage data. They know what you earn through other reporting mechanisms, right? And so if they can see that you're still eligible, that you still earn below X amount and you're still eligible, they can skip sending out the paperwork altogether.
That process, known as ex parte renewal, could save millions of people's insurance in states that refuse to use it. In fact, only 3% of renewals in Texas happen that way. Ultimately, though, there's a more permanent solution.
And it is incumbent upon every state that has refused to expand Medicaid to give them healthcare coverage back. While the pandemic may be over, COVID is not. But we have a number of other diseases, chronic health issues that hurt our states and hurt our economies because we're not providing coverage. But on the other side, there are millions who are losing coverage not because they're not eligible, but because the states are making a mistake and not providing adequate information.
I feel like healthcare for people who can't afford healthcare should be like a priority. I mean, I'm not out to like take advantage of anything. I'm not trying to get something that I don't like really need, and I work, I'm a contributing member of society. I pay my taxes every year, even though I work for myself. I mean, I definitely don't want to be on it forever, but when I need it, it should be available,
But I want folks to know that if you go to healthcare.gov, you can find out what your eligibility requirements are. You can find out who to reach out to in your state. But you also should band together and make certain that the groups that want to reach you, the groups that want to help you, that they know that you need help.
Thank you so much for watching our video. If you'd like to see more stories like this one, be sure to like and subscribe to the channel to get more Perfect Union in your feed. And if you have any ideas for stories that you would like for us to investigate, just drop them in the comments below.